Hello, everyone. My name is Yiran Zhao, and in this video, I will introduce our paper on supporting goal-based collaboration for hospitalized children. We started this project because it is very difficult for pediatric patients who are hospitalized to express their voices in their care. And I hope to illustrate that through a patient story. This patient was 13 years old when she participated in our study. And when she tries to engage in her care, not only did she face the power differential between her and the adult caregiver, who for most patients are their parents, as well as to the adult care providers who are nurses, physicians. She also experienced lots of mental and physical distress from the health condition that put her in the hospital in the first place, from medication side effects, and from the instrumentation she had to attach to. And she was so uncomfortable that eventually she stayed in bed all day with windows shut and the lights off. And despite all of this distress, when she attempted to raise her voices to the care, her voices are constantly overlooked. For instance, one of the care provider told her to be quiet when the provider was speaking with the patient caregiver, which signaled to the patient that her involvement in her own care was not welcomed. And what I just described is opposite to the patient-centered care model that our healthcare system is going toward. In fact, the Agency for Healthcare Research and Quality listed patient-centeredness as a key healthcare quality, and that patient's value should guide all clinical decisions. Patient-centeredness comes from supported and respected patient engagement. And even in the case of pediatric care, many studies have shown that pediatric patients want to be a part of their own care. So we thought, how can we make this situation a little better? How can we support engagement for pediatric patients who are in the hospital? One model that works well is the collaborative goal setting model that many outpatient settings adapted. The collaborative goal setting model is when the patients share their personal goals and when the providers share their medical goals. And by sharing their goals, they work toward a care plan that are aware of both the personal goals of the patient and the medical goals. Outpatient setting is, however, very different from the inpatient setting, and that inpatient goals are more driven by the providers, and inpatients are treated to solve the problem that leads to hospitalization. However, even for inpatients, our prior work on patient portal design showed that inpatients want to share their personal goals with the providers and share their personal voices. So, given the understanding that patient goals can facilitate patient engagement, we sought to explore if sharing patient goals can help pediatric patients. Specifically, we want to answer how do pediatric patients set and share goals, and how does goal setting and goal sharing affect patient engagement for hospitalized pediatric patients. To answer this research question, we first needed to give pediatric patients the opportunity and the tool to set and share their goals. Based on our previous study, we designed and built a portal-like application, Plan and Talk. Plan and Talk has two sections. One of the sections is the plan section, which the patient can articulate their goals and put the goals into a timeline. The design goal for this section is to enable patients to set their personal goals. The other section is the talk section, which is a discussion board. The patient could mark a goal being need to talk or going well, and the goal will appear on the appropriate section in the discussion board. The design goal of the discussion board is to enable providers and caregivers to see the patient's goals and to facilitate and make it explicit that discussion around the care plan should be grounded on patient goals. We took a patient-centered approach and primarily interviewed patients. However, due to the nature of pediatric setting, the caregivers are sometimes with the patient during observation and during interview, and therefore we also collected the caregiver's perspective. In addition, we interviewed 4 physicians who were treating these 13 patients. In the 13 patients, we featured a broad age range from children at 7 years old and legal adults for above 18. The reason we included these legal adults is they are still treated under pediatric setting for a condition that they have been treated under pediatric setting. So they fall into the care setting of the pediatric setting. We collected 3 types of data, which include pre-deployment interview transcripts and post-deployment interview transcripts. Note that for the post-deployment interview, we also interviewed the care providers. During the deployment, we conducted observation session when the patient, caregiver, and providers use Plan and Talk, and we also collected user input by the patient into the Plan and Talk. We found that setting and sharing patient goals can reduce the collaboration barriers in patient-provider collaboration and patient-caregiver collaboration. In this video, I'm going to talk about the findings on fostering patient engagement in care, and for the rest rich description, please refer to our paper. I first want to share our understanding that the caregivers have a very strong sense of control over the patient's care. They describe themselves as the advocate for the patient. However, this in turn turns to this encouragement for the patient to play a stronger role in their own care. For instance, P09 shared that she would always make sure her parents know whatever she will communicate to the doctor. Otherwise, her parents would feel that their awarenesses of the patient's care was hindered and question why the patient didn't talk to them first. A further consequence of the parental control is that the patient's ability to engage in care can be discounted. For instance, the caregiver of PO3 did not believe that the patient could use Planet Hog rationally. She thought that because the patient was in such a bad mood, she would go such as sue the hospital. The patients also reflected that their level of engagement is often discounted. For instance, PO7 shared that despite her awareness and effort to perform her daily lung function test, her mother was not aware of that and thought that she was slacking off. Because caregivers both take a strong role and question if the patient is able to engage in their own care, the patients do not get to engage in the care. As CO2, which is one of the physicians, reflected that he never really get to speak to the patient or communicate about the care plan. The patient engagement was taken over by the caregiver. The parents are, however, in a juxtaposition. On the one hand, they want to take strong control, but on the other hand, they worry if the patients are independent enough. And this is because the caregivers are concerned how well the patient can care and advocate for themselves once the patient becomes an adult. For instance, the caregiver of PO3 worried that the disencouraging and disengagement that the patient experienced would eventually lead to disengagement, not only in the hospital, but also in long-term care. And she specifically worried that once she no longer have parental control over the patient care, would the patient have enough understanding of their own care and have sufficient skills to advocate and care for themselves? So we found that goal setting could be a way to foster the patient's engagement in their care. Let's first take a look at what kind of goals that the patient set. Some of these goals are related to the values of the patients and priority of the patients, which in this case, for PO3, it's clearly solving the appearance issue that she experienced as a side effect. But some other goals, such as drinking 3 liters of water and walk around the room, are actionable and achievable steps that she could do during hospital stay. Which these actionable and achievable steps that PO3 set function as a care plan that she set for herself. Through setting a plan, the patient was encouraged enough to take action, and the caregiver of PO3 observed that PO3 was able to indeed walk around the room and did really well. And being able to set a plan and execute a plan is encouraging because it empowers the patient and gives the patient a level of control in their daily lives, which they have very little control over. And gaining control over their lives during hospitalization is a positive feedback loop. It helps break the disempowered state that the patient was in. The patient can be encouraged to take steps and decide what they need to do, execute it, what they need to do, be done, and feel good about themselves and feel achieved. And this positive feedback loop would also encourage them to move on to the next thing and tackle the next thing that they want to do. I want to discuss this setting goal processes in a broader context in which that a critical aspect for pediatric care is to support their transition into adult care or self-care. This is because while pediatric patients are being treated and being cared, they are also under a learning or education period, which they learn the skills needed to be an adult patient. Goal setting and goal sharing were able to be an anchor point to support this transition because setting goals help them learn the skills to plan and execute their care and help them on a larger perspective grow independence from the parental control they experience. In conclusion, our study summarized the collaboration barriers faced by pediatric patients, their caregivers, and their care providers during hospitalization. We also discussed in the paper the design considerations to support the different roles of pediatric goals. Most importantly, we characterize that setting and sharing patient goals can reduce the barriers to patient engagement for hospitalized pediatric patients, and that tools that include patient goals can support the unique challenges faced by pediatric patients, which are navigating the tension between patient and parental control, as well as supporting them in the transition to adult care. I also want to mention that Planet Talk is open source and it can be found in the supplement material in our paper. This paper is made possible by the wonderful patient safeguard team advised by Dr. Wanda Pratt, and the amazing support from our patients, family, providers, and staff at Seattle Children's Hospital. We also thank AHRQ for funding this study. And if you have any questions or you would like to discuss anything, I can be found by the 3 methods listed in the video. Thank you so much.